Good morning, and a beautiful sunny morning it is. I wanted to talk to you today about the old chestnut, and here I am standing next door to Hazel's, of low back pain. We are told that 90% of people with acute low back pain will get better within 6 weeks. If it's a bit more than acute and you can't cope with it, you can't go to work, then okay, you see a GP and they will give you painkillers, anti-inflammatories, and advise you to keep moving, which is right, and hopefully it will go away within 6 weeks. However, we're also told that 62% of people with low back pain have still got it 1 year after their first episode. Now, we find that quite incredible. It should not be like that. If I tell you that 77% of our patients at Stort Physio have spine-related conditions, and most of those are low back pain, they will get better on average within 2 sessions. But what we do find is that almost always they start with a slip, a slide, or a fall. Now, this doesn't have to be something that's serious. It doesn't have to have bones sticking out or blood and gore and ending up at A&E for about 5 hours and given anti-inflammatories and painkillers. But you can have that slip and slide or fall and you don't really notice it. You could have been on holiday this summer with the children and you fall over because you think you're 16 again. And you get up because your pride is probably hurt more than anything else, and you don't think any more of it. Why should we? If we thought of every fall or remembered every fall or slip that we had, we'd all be paranoid by now, frightened to put one foot in front of another. But we don't. We only remember the serious ones, and in fact we have patients who've forgotten some major traumas. But nonetheless, most of us will have slips, slides, falls, trip over the dog, whatever, and we don't remember. The problem is that that's when it all starts, because what it does is to jam up the joints of the sacropelvic area, and that in its own right then stops the pelvis moving properly, stops a whole bunch of stuff moving properly, and ultimately you may bend down to pick up a fallen apple, a piece of paper off the office floor. Doesn't really matter. Some simple, easy movement, and that's enough to tip the balance and cause low back pain. And the low back pain can come from the sacroiliac joints, from the discs which have now been loaded above, from the joints on either side of the spine, whatever. That's our job, to find out what it is. And that's what we are skilled at, is the diagnostic side. We can tell you whether or not you have a sacropelvic dysfunction, whether you have a problem with the joints on the so-called facet joints on either side of the spine, or whether it's a disc problem, or indeed whether it's not for us at all, whether you need to see a surgeon, a consultant. It's that only 1% of back pain that has a serious cause, and we are skilled enough to tell you that. But for the vast majority, we can determine what the condition is, how to treat it, and what you can do to help yourself. That's what we're all about. So if you've been away on holiday with the kids, as I say, imagining that you're 16 again, and you've had a slip, a slide, or a fall, or not, but you got these niggles, then let's have a look at it. That's why we run free assessments, so we can pick up conditions before they become serious. And if they are a problem, then we can treat them, we can show you how to stop it happening again, and we can deal with all the aspects of it. That's what we do. That's where all of our years and years of clinical expertise, postgraduate knowledge, everything, it all comes together for you, the patient. So if you don't know, if you're not sure, then give us a ring. Come and see us, free assessment, and we'll tell you what's wrong. Have a good day, and I'll see you again soon.